I'm Dr. Heather Nelson, and this is a 5-minute pedagogy class. What's small, well connected, and a little hard to say 5 times fast? That's your hyoid bone. Let's get to know this completely unique and fascinating bone in your body. It looks like this. It's horseshoe shaped and it lays horizontally in your throat, kind of like this. The first part up here, the bigger part, is called the body. And then it has these two protrusions that are called the greater cornu or greater horns. Cornu is just a Latin word that means horns. Now, it is completely unique in the body because, unlike every other bone in your skeleton, it doesn't attach or articulate to any other bone. It's just kind of a floater in there. If you want to find it, you can take a finger or two and stick them right where your neck meets the junction of your chin and push in just a couple of millimeters and swallow, and you'll feel that body roll over your fingers. You can feel just how much movement that bone has. It's super cool. Now, one of the things that's also unique about the hyoid is that, unlike many of the bones in your body, it's a little closer to cartilage for most of your life. When we get a little older is really when it turns to something that's closer to total bone. And that gives it even more flexibility throughout your life. Now, because it's not connected to any other bones, it has all those flexibility that level of flexibility. It gives it some really important anchoring functions for some things that are really important in your mouth and in your neck. From the top of the hyoid, it's connected to the base of your tongue and some of the muscles in the floor of your mouth. And that gives the tongue and your mouth an anchoring point. So when the tongue is articulating diction or helping with chewing or swallowing, the hyoid is where that bone kind of settles in at the base. From the bottom, the larynx is suspended from the hyoid, and so through various muscles and tissues, the larynx can also move up or down, or the hyoid can move closer to the larynx depending on what your body needs it to do. And that gives the larynx also quite a bit of flexibility while staying anchored to the hyoid. Now, the hyoid itself, we don't do anything to affect its function. It's just kind of along for the ride. We can kind of, sort of, work with its placement by, particularly in singing, by working with how these muscles are either engaged or relaxed in the position of the larynx. But in general, it's just doing its thing. It's hanging out, and we don't really have any reason to pay much attention to it unless it gets damaged. If there happens to be some damage to the hyoid, particularly after it gets a little harder later in life, it can affect speech because of its connection to the tongue. It can affect breathing and swallowing because of its connection to the larynx. And that, of course, can be problematic. But for most people, it's just there, it's doing its thing, and it really helps us to speak, sing, swallow, breathe with a lot of flexibility. It's totally fascinating. So I hope by learning more about the hyoid, you grow in fascination with how the voice works and you show just a little bit of appreciation to that unsung hero, your hyoid. If you have any questions, please drop them in the comments or you can send me a message through my website, drheathernelson.com. Happy teaching and thank you for watching.